Hey, David Kleiman here at Cobb County Fire and Emergency Services, part of the EMS division. Today I'm going to talk about cyanide kit. What is it, some of the side effects, and more importantly, how do we administer this? So hydrogen cyanide. So like we tell everybody here at Cobb Fire, where there's smoke, there may be cyanide. Remember, cyanide is released in any type of synthetic, plastics, silk, anything in new modern day construction in a fire, cyanide is released. So it's especially present in an enclosed space during a fire. So we know that the products of combustions, we're going to have hydrogen cyanide and we're going to have carbon monoxide that's going to be released. So if you're looking through the signs and symptoms of hydrogen cyanide compared to carbon monoxide, all the underlying stuff shows you that they have these same signs and symptoms. Both of them have headaches. Both of them have nausea, vomiting. Both of them have confusion, dyspnea, coma, seizures. So with that being said, here at Cobb Fire, we tell you if you're in a house fire, a car fire, anything that has smoke in an enclosed space, and the patient comes out confused with an altered mental status, some soot around their face, we say this is hydrogen cyanide and treat them. There's no way to differentiate between the two on scene. So our protocol is anybody who's been exposed to fire or smoke in a closed space, anybody that has soot around the mouth, nose, or back of the mouth, and they have an altered mental status, any type of confusion or disorientation, Cobb Fire will be administering a cyanide kit. And today is why I'm going to be teaching you guys how to mix it and how you all can administer it on our behalf. So before we talk about how hydrogen cyanide affects the cells, let's talk about what normal cellular respiration is. So normally when you breathe in oxygen, oxygen gets in there and gets on your red blood cells. Oxygen is then transported on your red blood cells to your cellular level. At the cellular level, oxygen, via the cytochrome oxidase complex, gets into the mitochondria, and from the mitochondria, it is then that oxygen is used to create ATP, normal cellular energy. This is aerobic metabolism with oxygen. How does cyanide affect your respirations? Well, what happens is once you get cyanide, you breathe cyanide in or it gets into your bloodstream, cyanide will then get down at the cellular level. And at the cellular level, cyanide disrupts the cytochrome oxidase complex, which prevents oxygen from going into the actual cells, into the mitochondria. And now your mitochondria cannot produce energy via oxygen, so now it has anaerobic metabolism. And remember, one of the byproducts of anaerobic metabolism is lactic acidosis. And with lactic acidosis, this will clinically manifest itself as metabolic acidosis. And when you have enough metabolic acidosis, you start to have cellular dysfunction. And from cellular dysfunction, you eventually have cellular death. So at Cobb Fire here, we're going to be administering the cyanide kit. The cyanide kit is actually hydroxycobalamin. So how does hydroxycobalamin work? What happens is when the cyanide kit is actually administered into your body, hydroxycobalamin will actually go down to the cellular level. Remember, cyanide is attached to that cytochrome oxidase complex, preventing oxygen from being used intercellularly at the mitochondria. Once it's down there on that cellular level, hydroxycobalamin will actually pull cyanide ion off of the mitochondria via the cytochrome oxidase complex. And what happens is when that cyanide touches that hydroxo, it then turns into cyanocobalamin, B12. It turns it into B12. So now we have pulled cyanide out of the mitochondria. We've turned it into B12. We can pee that B12 out, and more importantly, oxygen can go back into intercellular via the cytochrome oxidase complex, and we have now gone from an anaerobic metabolism, no oxygen, producing lactic acidosis, causing cellular death, to now back to oxygen being used at the mitochondria level to create energy, which is our normal cellular respiration. So let's talk about some of the side effects that can happen when you administer the cyanide kit. One of the coolest things you'll actually see, in my opinion, is that you, for the next 24 to 7 days, you will actually turn around and get red skin and eyes because you have an excessive amount of B12 in your skin. So here's a couple cool pictures, and usually by day 8 the person's back to normal. You will have urine discoloration. It will be very bright red. Some patients contain vomiting and diarrhea, but remember, these patients are going to be unconscious. The biggest side effect is a transient hypertension. When they did the studies, the transient hypertension increased the systolic BP, typically 15 millimeters of mercury. Now remember, these patients are unconscious typically. They're going to be hypotensive, so it's actually a good side effect in our behalf. This is Cobb County's fire protocol for the cyanide kit. All right, we classify as a B12A. All right, because remember, it turns into B12A once it pulls the cyanide ion onto it, the hydroxycobalamin. So as you can tell, it's a synthetic form of B12 used to treat different types of B12 disorders. For us, it's cyanide poisoning. The half-life for this is 6 days. Some of our indications that we can give it for is any type of cyanide exposure, and then with orders, any type of alcoholism, malnutrition, hypothyroid, or renal disease. The only contraindications if somebody's allergic to this, but typically you're not going to know that at the time. Once again, like I said, side effects: red eye, skin, discoloration and urinating, vomiting, diarrhea. On your adult dose is going to be 5 grams. On the pediatric dose, we're going to go through it. I'm going to show you guys how to mix it, more importantly, how to draw it up for the pediatric and how to give it. You'll want to give both of these over 15 minutes, all right? This can only be given through a dedicated line. So if we're working that patient that we bring out of a house fire, we need an IO just for the cyanide kit, and then a regular IO if you're going to be doing fluid resuscitation and also any type of medications. And then our 2 protocols we're going to go through after I show you guys how to mix it. So remember, the cyanide kit, the antidote kit, is on every ALS equipment in Cobb Fire and also the battalion chief's vehicle. It's going to be in a little yellow Pelican case. And when you open up the Pelican case, you're actually going to have the actual cyanide kit. Inside the cyanide kit is a glass vial with 5 grams of the cyanide kit antidote, the hydroxycobalamin. You're going to have a 60cc syringe. You're going to have a 3-way stopcock. And you're going to have a 2-way spike. And you're going to have a dedicated drip set. This drip set is important because it actually has a filter in it to catch any of the particulates that do not completely mix when we mix up the antidote kit. It also has a different type of ventilation because this is a glass vial, and it'll actually help the medication flow smoothly. All right, so the first thing we got to do is we've got to administer 200 cc's of your normal saline into the cyanide kit. You see the black line right there? That's going to tell you to 200 cc. It's also written on the box multiple places that it needs 200 cc's. So the first thing you're going to do is grab your double spike, and you're going to put the spike right into your normal saline. You're then going to take the cap off of your cyanide kit and take your other spike and insert it. And when you do, we're looking for 200 cc's. Mixing this kit takes between 3 and 5 minutes. This is something that when you think you need it, go ahead and have somebody start mixing it. So as you can see, as you're putting the medication, the normal saline in, it's actually turning it red. And at this time, I am almost there with the 200 cc's. You can see the fluid is actually at the black line, and I've confirmed I've given 200 cc's in here. The next hardest thing and the most important thing is now mixing the medication. Remember, when this medication is in this glass vial originally, I like to call it half mixed Kool-Aid, and so it's very thick and powdery in there. You put the 200 cc's in, as you can see, it's already a little bit mixed, but now the important thing is we're not shaking this like we're doing Solumedrol or something. We are actually, and if you look, they've actually got little pictures on here. you're actually going to gently swirl the medication back and forth, or you can gently rock. I like to go back and forth nice and swirl. Remember, putting in the 200 cc's and then actually doing the mixing. This is going to take about anywhere between 2 and 5 minutes to do it properly. You cannot have any bubbles form. If bubbles form in this glass vial, you cannot administer this. You have to go find a secondary kit. So now that I have thoroughly mixed this, I'm then going to take the drip set that has been dedicated with this. And at this time, you're going to spike. Remember to flush your IV tubing out. Once your IV tubing's flushed, we are then ready to administer the cyanide kit. So I'm going to go over a couple of little protocols that have indications for using the cyanide kit. Remember, we're making this simple. If COB Fire pulls anybody out of an enclosed space that had smoke, so that house fire, car fire, could be a camper fire, whatever it is, enclosed space, it's got smoke present, the patient's got soot around their nose, mouth, or in the back of their throat, and they have any type of confusion or altered mental status, we're going to administer the cyanide kit. So as you can see here on the burns and airway distress, at the very bottom, any type of cyanide exposure, you're going to give them the cyanide kit. The cyanide kit had 5 grams in 200 mLs. 5 grams in 200 mLs. You're going to administer for any adult patient 5 grams over 15 minutes. I'm going to come back to the pediatric in a minute and show you how to properly draw it up and administer it. But both of them are over 15 minutes. And here's the smoke inhalation protocol. Anybody who potentially has cyanide exposure, once again, confined space, an enclosed space of any type of smoke from a fire. Remember, COB Fire is going to remove them from that environment. They're going to try to decontaminate them as much as they can. But look here, we're going to get a dedicated IV or IO. We're going to give them the cyanide kit. Adult patients, 5 grams. 5 grams over 15 minutes. The cyanide kit is 5 grams in 200 mLs. So in the top of every cyanide kit, you're going to see that COB Fire has put a cyanide kit Broslo tape. So as you can see right here, it's the same thing set up as your Broslo. So let's say our patient's a yellow, which is your 12 to 14 kilograms, or your estimated 26 to 30 pounds, or your 2-year-old. So you can go by age, weight, and that's going to give you a number. The important thing here is the cyanide kit has already been figured out for you. So if I have a 2-year-old, I'm going to draw up 36 mLs, which is the volume. I'm going to grab 36 mLs. That's the milligrams you're going to administer. Or I can waste 164 milliliters from the vial to leave me the 36 to administer to my patients. I like to tell people when it's less than 60 mLs, draw it up in your syringe and give it over 15 minutes. If it's going to be you by yourself and you got a lot of stuff going, that's why we give you the volume to be administered or how much to remove from your vial so you can then administer what's left over 15 minutes. So how do we pull up what we need? Remember, this is a dedicated drip set because it's got a filter in here, and this filter will stop any particulates that didn't get mixed. It's also got a different ventilation port because you're under a glass tube and you have to use your ventilation different. So inside every COB Fire kit, you're going to have a 3-way stopcock. And as you can see, where it says off, whenever it says off, it's pointing. So right now the IV tubing's off. I can turn it off to, let's say this is going to the patient and this is going to a syringe. So normally if this was just going to a straight adult, you can either put it straight onto their INT or you can hook it up to the patient this way. This would be going to the INT. But let's say, in this case, on that 2-year-old, I'm drawing up 36 mLs. I would put my stopcock on. I'm going to turn off this way to the patient, and in this case what I'm going to do, I'm going to draw up slowly 36 mLs. Make sure I get out my type of bubbles. Turn it off to my cyanide kit. And now, because it's off to my cyanide kit, I can unscrew, and I've got 36 mLs I can administer to my patient over 15 minutes. If you notice here, you're administering 74 mLs. What's easier? Drawing up 60 cc's, giving it over 15 minutes, then trying to go back for the 14? Remember, this medication is life-saving. It's easier to take a few minutes and draw up 126 cc's out of that vial, squirt it in the trash can, squirt it on the ground, wherever. I'm going to draw up 126. That's going to leave me 74 left in the vial, and I'm going to administer that over 15 minutes. Let's say I'm on an orange patient, that 7 to 8-year-old. If you notice here, you're administering 74 mLs over 15 minutes. So it's easier to draw up 126 mLs to waste it out to leave 74. So once again, I'm going to take my 3-way stopcock. I'm going to turn it off to the patient. I'm going to draw up a straight 60 cc's the first time. Turn it off to my patient. I'm going to pull up my syringe. I'm just going to squirt that out on the ground, trash can, whatever I have. I'm going to hook it back up. I'm going to draw up another 60 cc's, an additional 6, which will leave me 74 in the vial that I'll administer over 15 minutes. So if you have any further questions, feel free to reach out to the EMS division in Cobb County Fire and Emergency Services, and we'll happily come out and do any additional training you need.